morning. My name is Shea. I'm a heart surgeon at Columbia and Stamford Health. I'm going to take you through what a typical day is like for me.
I'm thinking about taking care of patients that I haven't seen, since the day before, or if it's the weekend, since Monday. I'm thinking about all the different things, all the different scenarios that could happen and what we would do in each situation. As you do this for long enough, these situations and these sort of scenarios become very routine and very straightforward, but certainly there are always small hiccups along the way. And so I'm quickly going to change into scrubs and then we'll go see our first patient for today. I'll generally take the back stairs, quickest way and less traffic. So I'm just going in to see our patient for today. She's got a leaky mitral valve. There are 4 valves in the heart. One of the leaflets is lifting up above the level of the other leaflet and allowing it to leak significantly. I make a habit of always seeing my patients in the morning before surgery. I think that, one, it's just really important for them to see me on the day of their surgery. This is a big deal. It's a big operation to have, and you're putting your life in the hands of somebody else. That's a very vulnerable and scary place to be, and I think knowing that that person is there and ready and seeing them in person may be a small thing, but is meaningful. Second, it helps me check in on any last issues or concerns or any worries that they may have. I want to be here and present so that we can troubleshoot those things and all be ready and on the same page before we go into the OR. Communication and teamwork is critical for us to being successful at this. This is not a one-person show. Most mornings it's like this. The patients feel ready. There's not much to say, and it's a bit of just a social visit, but I think a meaningful one. In particular, in a case like today, I'll always review the imaging one more time before the start of the case and just sort of think about exactly what my plan is. Usually it's just reassurance for myself to do what I, already sort of thought I was going to do, but I just want to see the imaging one more time and feel confident in my plan A, B, and C for all the different ways that things can go in the operating room. We have a team of multiple physician assistants. There are also general surgery residents who work with us, but the physician assistants, we have one that works with me in the operating room every day, and then there are a few that are on the floor covering the patients in the ICU and up in the floor. So we just ran into Denise, who's our PA, who's in the operating room today and will be operating with me. We're headed to the ICU where we'll see our patients from the previous day's operations, and then we'll go up to the floor. They're the patients that are no longer in the ICU. I'm going to meet a couple of my team, the PAs that are with us today in the ICU, and we'll go through our patients. As you can see, this hospital is beautiful. I think it's the nicest hospital that I've ever been in, and our ICU is really spectacular. More important than that, than just getting your own room and having a beautiful space, the level of care that we have in the ICU and the experience of our nursing team is just phenomenal. So let's go track everyone down, see how the patients are doing. Now that I've seen the patient, they roll back into the operating room, and then there's just like an hour or two to prepare the patient and to get them ready and everything. So this is like a nice gap of time where do paperwork, see patients, round on everyone, do whatever. For me, I like to operate with music. I don't think it interferes in any way with what we're doing. I like to try to play music that everybody likes. It's very important to me that everybody in the operating room feels happy and comfortable and relaxed. I try to ask everybody, what do you guys want to listen to today? In general, everybody is very deferential and just popular music that I think most people can listen to, enjoy. You'll see. So every OR is a little different, and I think, it's up to the surgeon to set the tone. For me, I really need a relaxed environment. I think it's really important that everybody feel comfortable and confident and know what's going on and be able to communicate whenever they have a concern. So for me, that's a crucial thing, and I like to set that kind of tone. Like everything in medicine, this is a team sport. Morning, everybody. Just filming parts of a day in the life. Yeah. How's everybody doing? Good? Yeah. All right. Are we ready? All right. I'm going to put on a Teddy Swims Pandora. So it won't all be Teddy Swims, but single wires, 2 chest tubes, physio 2 ring if we repair, mitral if we replace, non-pledgeted sutures. Yeah, probably repair. Okay. So we just finished mitral valve repair and left atrial appendage ligation on our patient. She did really well. Right after surgery, what I always do is I go straight out to the waiting room and I talk to the family. I think just, knowing that what's going on, that we're done with the operation, that she's made it through the operation, in the OR part of things safely and smoothly, and that's really important. The next thing I do, I usually come straight back up to my office and I do a couple things that are on my checklist every single time. This is just how I do things. One is that I make a log of every case. I keep my own personal logs and I log all sorts of things. It's usually what the case was, any little notes about what happened during the procedure or little things to think about or very small technical things. I keep track of the time. So we always keep track of cross clamp time in cardiac surgery, which is the time that the heart is stopped, bypass time, which is the amount of time that the body is on the heart-lung machine. And then I keep track of skin-to-skin time, so what is just the overall operative time. The next thing I do is I reach out to the cardiologist and the patient's primary care doctor and let them know, same thing, how the surgery went, what we did, how long I expect the patient to be in the hospital, and make sure everybody has my numbers. I just catch up on emails and text messages and all the various things that come in while I've been out of touch and in the OR operating. Seeing patients back in the clinic is really rewarding and satisfying, and you see them back to normal, back to their full level of activity. They're telling you about what they're doing, that they're going for walks, that they're seeing their grandchildren, that they're able to travel again and do all of those things and back on a sort of normal life trajectory. Usually my last stop is in the ICU one more time. I like to see the patients, especially from that day, the patient I operated on that morning or that afternoon, and see those patients one more time before I go home. Certainly, being a cardiac surgeon, all of our patients, tend to be critically ill after surgery. You have to be a good ICU doctor as well, and you have to be able to take on that responsibility and see the patients consistently as well. When I go home, I have young kids, and they're always excited to see me. They're fortunately still at that age where they run and give me a big hug, and I think for me that is always the best part of my day, and really helps me sort of switch off to the extent that you ever really switch off. Well, this has been a day in the life of a surgeon, and thanks for joining us. Now it's time to go home.